Imagine a jagged stone blade slipping, a deep, pulsing gash across your palm. There are no pharmacies, no aspirin, no clean gauze, just you, the dirt, and a pain that feels like a rhythmic hammer against your skull. 10,000 years ago, during the Neolithic transition, humans were settling down to farm, but they were still living at the mercy of biology. When your teeth rotted, your bones broke, or your joints swelled with arthritis, there was no calling a doctor. Yet, somehow, humanity survived. We didn't just endure the pain, we hacked it. For thousands of years, the world was a massive, living pharmacy. If you lived in the Fertile Crescent around 8000 BCE, your primary medicine cabinet was the forest floor. You didn't reach for an ibuprofen tablet, you reached for the bark of a willow tree. Willow bark contains salicin. It is the chemical precursor to modern aspirin. When you chew on that bitter, fibrous bark, your digestive system converts salicin into salicylic acid. It is an anti-inflammatory, an analgesic, and a fever reducer. It was humanity's first painkiller in the true sense of the word. We didn't know the chemistry, but we knew the result. The throbbing stopped, the heat in your body cooled. We were amateur biochemists long before we were scientists. But pain wasn't just physical, it was spiritual. If a person suffered a sharp, stabbing pain in the abdomen, Neolithic humans didn't always look for a physical cause. They looked for a metaphysical one, a spirit, a curse, an imbalance. This led to one of the most brutal and fascinating medical procedures in human history, trepanation. Evidence from sites like Jericho in the West Bank shows skulls with perfect circular holes drilled directly into the bone. We are talking about 8,000-year-old surgery. Using flint blades, ancient healers scraped away the scalp and bored through the hard cranium. Why? To let the demons out. To modernize, this looks like torture, but consider the context. If someone was suffering from chronic, blinding migraines or the agonizing pressure of a localized brain infection, the pain was unbearable. Trepanation wasn't about cruelty. It was a desperate attempt to relieve intracranial pressure. And the wild part, we have found skulls where the bone grew back around the hole. People survived. They walked around with a permanent window into their brains, just to stop the pain. Across the globe, in the Americas, ancient people were doing things differently. They were masters of the mind-body connection. They discovered that pain could be modulated through consciousness. Coca leaves were the answer in the high Andes. Thousands of years ago, indigenous people chewed these leaves to numb the body and sustain endurance. It wasn't just a stimulant, it was a local anesthetic. It deadened the nerve endings in the mouth and throat. If you had an abscessed tooth or a raw, infected gum, chewing a wad of coca was the only way to eat without agony. But what about the truly catastrophic pain, the kind that breaks you? That is where the poppy plant comes in, opium. 6,000 years ago, in the Mediterranean, humans discovered the poppy. When you score the seed pod, a milky white latex oozes out. When dried, that latex turns into a resin that is one of the most powerful painkillers on the planet. Our ancestors weren't just eating leaves, they were practicing pharmacology. They knew that poppy juice could render a person catatonic. They used it to set broken bones. They used it to pull teeth. Imagine being a healer in 4000 BCE. Your tools are stone, obsidian, and fire. You have no anesthesia. You have to cauterize a wound to stop a patient from bleeding out. You take the poppy resin. You give the patient a dose. Their eyes glaze over. Their heart rate slows. You take a white-hot piece of iron from the fire and press it into the flesh to seal the veins. The patient doesn't scream. They barely blink. That was the edge of human survival back then. But it wasn't always chemical. Sometimes it was structural. Think about the physical trauma of 10,000 years ago. You're carrying heavy grain sacks. You're kneeling for hours to weed crops. Your lower back is a nightmare of inflammation. We have skeletal remains from early Neolithic burials showing that people had severe spinal degeneration by the age of 30. How did they fix it? Heat. Across Europe and Asia, we see the remnants of sweat lodges and hot stone therapy. We found evidence of hot volcanic rocks placed against joints. The heat increases blood flow, reduces muscle spasms, and triggers the release of endorphins. We have been doing physical therapy for 10 millennia. We just didn't have a name for it. There was also the use of earth medicine, or geophagy. In some cultures, healers would prescribe specific clays rich in minerals like kaolin or bentonite. When ingested, these clays coat the lining of the stomach. If you were suffering from the agonizing, burning pain of an ulcer or food poisoning, a slurry of clay was your only relief. It acted as an absorbent, pulling out toxins and soothing the inflamed gut. It's the same logic we use for Pepto-Bismol today. But here is the darker side. For a long time, historians thought ancient humans were peaceful savages living in harmony. The bones tell a different story. We see signs of interpersonal violence everywhere. We see arrowheads lodged in vertebrae. We see clubbing injuries to the skull. How do you treat a spear wound in 7000 BCE? The answer was honey. Thousands of years ago, honey was the gold standard of wound care. We know this from ancient Egyptian records, but the practice goes back much further. Honey is hygroscopic, meaning it pulls water out of bacterial cells, effectively dehydrating and killing them. It is also acidic, which prevents bacterial growth. When a hunter was gored by an animal or slashed by an enemy, a pack of honey-soaked moss was the most sophisticated antibiotic in the world. It kept the wound moist, prevented the bandage from sticking to the raw tissue, and fought off the infection that would have killed them within days. We had to be inventive because our lives were fragile. Think about the psychological toll of chronic pain. We don't talk about this enough. Today, we have antidepressants and therapy. 10,000 years ago, you had the community. We see evidence in the archaeological record of people who were clearly disabled or in constant pain being cared for by their tribes. We have found the skeletons of elderly people who lived long, difficult lives with fused vertebrae or severe infections. These people couldn't hunt, they couldn't farm, they couldn't defend themselves, yet they lived. Why? Because the tribe recognized that pain is a social burden. By sharing the load, by feeding the sufferer, by providing them with medicinal poultices, by simply keeping them close to the fire, the tribe effectively mitigated the pain of existence. Caregiving was a medical technology. Empathy was a survival mechanism. But let's address the elephant in the room, the placebo effect. A lot of what we consider ancient medicine today looks like magic. Chanting, talismans, burning incense, tying knots in ropes. If you had a chronic, unexplained ache, the shaman might perform an elaborate ritual. From a modern scientific perspective, we call this the placebo effect. But in a Neolithic context, it was real. By shifting the patient's focus, by ritualizing the pain, by giving the patient a sense of agency, the shaman was engaging the brain's internal pharmacy. When you believe you are being healed, your brain releases dopamine and endogenous opioids. You are literally numbing your own pain through the power of expectation. We look back at 10,000 years ago as a primitive time. We think, thank God we have modern medicine. And we should. If I get an appendicitis today, I want a surgeon, not a shaman with a flint blade. But there is a humbling realization here. Almost everything we use today in our high-tech hospitals has a footprint that goes back to the Neolithic era. Our anti-inflammatories, our anesthetics, our wound dressings, our physical therapy, our psychiatry, they are just highly refined, laboratory-grade versions of the things our ancestors clawed out of the earth. The willow tree, the poppy pod, the honey, the clay. The human experience of pain has not changed. The agony of a broken bone in 8000 BCE felt exactly the same as it does today. The pulse, the heat, the sickening nausea of a trauma wound. Our ancestors faced this with nothing but their ingenuity and their sheer, stubborn will to survive. They didn't have the internet. They didn't have antibiotics. They didn't have a 9/11 dispatch, but they had an intimate, terrifying, and profound relationship with the natural world. They learned that the earth that could hurt you was also the earth that could heal you. When you look at a bottle of aspirin today, you aren't just looking at a miracle of modern chemistry. You are looking at a 10,000-year-old conversation with a willow tree. We often think we have conquered pain. We think we have engineered it out of our lives. But have we? Or have we just moved the goalposts? We have drugs for the body, but we are arguably more lost than ever when it comes to the pain of the mind. We have lost the tribal caregiving that held the elderly and the suffering in the center of the village. We have lost the ritual connection to our own healing. Perhaps the most important thing we can learn from 10,000 years ago isn't the chemistry of a poppy or the utility of honey. It's the realization that pain is not a failure of the human condition. It is the condition itself. It is the hammer that shapes us. 10,000 years from now, people will look back at our modern medicine and see it as just another primitive attempt to manage the unmanageable. They will see our MRIs and our surgical robots as the flint tools of a confused early civilization, and they will ask the same question we are asking now. What did they do when it hurt? They did what they could, they experimented, they cared for one another, they endured, and in that struggle, they defined what it means to be human. We are the survivors of a long, painful, and deeply inventive history. Every time you feel a twinge of pain and reach for a pill, remember, that is the ghost of a Neolithic ancestor teaching you how to survive, one leaf, one root, and one shared secret at a time. The pain doesn't stop, but neither does the cure. We are the architects of our own relief, and we always have been. The only difference is the tools we hold in our hands. The question is, what will we leave for the people who come 10,000 years after us?